Schizophrenia is a mental illness that creates disconnect between reality and fantasy within the patient. It affects the brain, therefore altering the patient's thoughts, feelings, and actions. Many factors can contribute to one having schizophrenia, including those of a genetic or environmental origin. Environmental factors may include exposure to famine, radiation, or drug use. Genetic factors include inheritance from parents and family history, which affects likelihood of developing this disorder. For example, according to a study by Tominga and Medoff called The Biology of Schizophrenia, if one parent has schizophrenia, the child has a 12% chance of developing it. If both parents have it, the child has a 30 to 40% chance of developing schizophrenia. There are several genes that can be strong predictors for schizophrenia. Our company provides people with the opportunity to test these different gene variations with a SNP Chip test. This SNP Chip test can detect the different gene variations that are associated with schizophrenia. According to SNPpedia, the SNP RS1006737 would be the best predictors of risk for schizophrenia. It impacts the CACNA1C gene, which encodes for calcium channels in the brain. When this gene is altered, these calcium channels are unable to be made in the brain's white matter. Additionally, as discovered from a study by Neal and Schuyler, if you carry the allele, you have anywhere from 60 to 90% of contracting schizophrenia. We also believe that the SNP RS13194-504 would also be a good predictor of risk for schizophrenia. It affects the C4A gene, which usually regulates the neural synapses. When the gene is altered, neurons in the brain do not fire regularly like they should. Since these SNPs, along with other variations, can alter someone's brain functions, our SNP Chip test will test for 108 different gene variations. This test could provide many benefits resulting from detecting whether or not an individual is at risk of predisposition for the disorder. Matt Johnson, for example, is interested in taking the test in order to determine how high his risk is for developing this disorder after his grandmother was previously diagnosed. The test will show if Matt is a carrier of the genetic variation that puts him at higher risk of developing schizophrenia. Being aware of this information could aid Matt in knowing how to avoid developing this disorder and could confirm his abilities in performing his job at a high level, giving him peace of mind. We don't know all variations for the risk of developing schizophrenia due to the gaps of understanding in all traits that cause schizophrenia. Just because one receives a negative test doesn't mean that they won't develop schizophrenia. It could be a possibility that they carry another trait that wasn't tested by our SNP chip. In contradiction, just because one receives a positive test does not dictate that they will inherit this disorder. There's a possibility that they may, but it is not guaranteed. According to SNPpedia, the ZBET9 gene contains a SNP RS1394504 that is representative of low-risk pairings for having schizophrenia shown in the AA and AG pairings. According to SNPpedia, other SNP chip companies' prices range from $100 to $1,000 due to our specified genome test. Our product will definitely be more on the affordable side. There are some emotional side effects in patients which include depression, anxiety, and stress before and after receiving test results, as confirmed by AJOP Empirical Bioethics and their study on genetic testing in young adults for schizophrenia. The pros of this test include clarity, prevention, and relief.